I also want us to talk about hypertension.
Yes.
So maybe you can give a brief introduction of what hypertension is.
Hypertension is defined as blood pressure, the systolic blood pressure above 135 and diastolic blood pressure above 85. So that is the definition of hypertension.
Yeah. So before I came for this conversation with you, there's somewhere I saw where it says like hypertension is a silent killer.
Yes.
So what does that mean?
Silent killer in the sense hypertension diagnosis is usually late, especially in Kenya, especially in Kenyan local population.
Right.
By the time they are diagnosed or they have some symptoms and diagnosed of hypertension, it is already stage 3, stage 4.
Wow.
Stage 3 is like blood pressure above 170, systolic blood pressure above 170 and diastolic blood pressure above 95. Okay, usually that's how we diagnose hypertensive patients,
Right.
especially in this country. So by the time we diagnose, already the target organs are the kidneys, the heart, the blood vessels, the brain, any of these any of these organs, the microcirculation is affected.
Yeah.
By the time we diagnose. So that's why it is a silent killer, because by the time we diagnose, patient already has got complications.
Right.
Because Kenyan people, they are usually healthy when compared to other populations, and they also have a lot of tolerance to hypertension.
Right.
And because of that, initially they don't show any symptoms, and by the time we diagnose, it's already late.
What are the most common causes or risk factors for developing high blood pressure?
One of the most common risk factors of hypertension is, just like diabetes, lifestyle. Consumption of high amounts of salt is one of the recognized risk factors for hypertension. Other than that, family history, that is like if your father and mother, either of them, they have hypertension, your chance of developing hypertension are very, very high, just like diabetes.
Right.
And also smoking, drinking alcohol, irregular lifestyle, not eating on time, skipping meals, having a very high tension filled life, sedentary lifestyle, like no exercise at all, always sitting or sleeping. Even the mental health issues like anxiety, neurosis, depression, these are all the things which can cause hypertension. One more important thing is thyroid disorders also can cause hypertension. And hypertension is invariably associated with chronic kidney disease also. And in diabetics, the overlap of hypertension and diabetes is very regularly seen.
Right. How can someone know they have hypertension if there are no obvious symptoms?
Checking for blood pressure.
How often do they need to check?
Usually for people above the age of 35 years, it's always better to check your pressure once in a while.
And how early can you detect hypertension?
Hypertension can be detected as early as stage 1 actually, if it is properly diagnosed.
Right.
Many a times we do that by subjecting the patient. I mean, the patient will be having minor headaches or swelling of the feet, especially when they travel. Patient will be having palpitations. Okay, these are all the signs of hypertension, and when these symptoms are present, it is when the patients contact us early in the course of the disease. Stage 1 hypertension actually can be managed without even medicines. If we think that okay, this patient may be having anxiety neurosis, control his anxiety and hypertension can be managed. But usually from stage 2, stage 3, they will require blood pressure medicines.
Can routine, for example, like day shift and night shift. So there are some people in Kenya who do day shift for 2 days and then night shift for the next 3 days. Can that affect?
If they have adequate sleep,
yeah,
and if they are relaxed, if they are living a normal life and they are not tensed, and if they are doing the night shift and they are having adequate sleep in the morning or in the afternoon, that is at least 6 to 8 hours of sleep if they are having, usually it should not be the case, because as doctors, when we are training, we are ought to do night duties.
Right. Yeah.
And our night duties schedule is also very long, especially when I am a resident in internal medicine. We used to have 36 hours, 48 hours duties.
Wow.
Yeah.
What lifestyle changes or habits can significantly help in managing or preventing hypertension?
Low salt intake, decreasing salt as much as possible. Active lifestyle, that is doing at least 1 hour of workout or walking, some physical activity every day. Having a regimentalized life, like eating on time, sleeping on time. Okay, not having mental tensions, not going for habits such as alcohol, tobacco, oral tobacco consumption, smoking, not doing drugs. These are all things they will definitely help.
Yeah. Let's end this hypertension topic with a myth and bust the myth.
Myth about hypertension is that most of the patients ask me, in diabetes it is possible to stop medicine, that is achieving remission is possible, but in hypertension achieving remission is not possible with at least current days technology. You need medicines lifelong. In hypertension you cannot stop medicines. Many people, they think that their hypertension is under control and they stop medicines. That is not possible in hypertension. It is possible in some scenarios where the patient is very much obese and we subject the they have pathological obesity and we subject the patient to metabolic surgery and they lose very significant amounts of their weight. In those people, yes, hypertension medicines we can maybe induce remission, but not in everybody. In a person who is having a regular life, hypertension medicines should be continued lifelong.
Yeah.
So that is one of the myths I have seen in my patients. And the myth buster that I would like to tell you is that diabetes is definitely treatable. Diabetes is remissible, especially in type 2 diabetes. In type 1 diabetes, there is no way. We have to give insulin lifelong. But in type 2 diabetes, it is always possible to achieve remission. By remission, we mean patient no longer requires medicines to control the sugar.
Yeah.
Yeah.
Okay, I have a final question. Is diabetes and hypertension linked to each other anyhow,
Yes.
or vice versa?
Mostly with the diabetic people tending to become hypertension is more rather than hypertension people becoming diabetic, unless they have a family history. But diabetic people becoming hypertensive is very routinely seen.
Yeah.
Yeah.
Okay, yeah. Thank you.
Yeah. Thank you very much.